promising news on the vaccine front. Executives from the major drug companies tell Congress there could be enough vaccines for 130 million Americans by the end of next month, but the pressure is on to beat the variants that are spreading, like the California variant. New studies determining just how much more contagious it might be. Eva Pilgrim has the latest on that.
Tonight, vaccine makers vowing to get doses out faster to meet that promised timeline. Enough shots for all U.S. adults by the end of July. Pfizer doubling the pace of production, cutting manufacturing time from 110 days to an average of 60.
We anticipate that will get up to 13 million doses a week by the end of March.
Moderna expecting to double its current shipments by April.
We are now targeting delivery of the second 100 million doses of our vaccine by the end of May, and a third 100 million doses by the end of July, a full 2 months ahead of schedule.
And now a third company, Johnson & Johnson, releasing details of its initial rollout, saying it can deliver enough of its one-dose vaccine to immunize 20 million Americans by the end of March, just about half of what they were contracted to deliver by then. Johnson & Johnson's vaccine could be authorized as early as late Friday.
We're prepared to ship immediately upon emergency use authorization nearly 4 million doses of our vaccine.
Welcome news after winter storms caused vaccine shipping delays and shortages. This as 2 new studies found the California variant appears to be more contagious, though more research needs to be done.
These results are quite concerning because it suggests that we have identified the emergence of a new variant that is spreading very rapidly in California and also that appears to be more infectious.
Meanwhile, more COVID restrictions easing in some states. In New York, sports arenas reopening for the first time in nearly a year at 10% capacity. Madison Square Garden will welcome 2,000 fans, Barclays allowing 300 tonight. To attend a game, fans need a recent negative COVID PCR test. Rapid tests will be available at the arena. Masks and social distancing will be required.
You can see the seats that we've designated as socially distanced seating pods, groups of either 2 or 4.
Eva, our thanks to you. I'm joined now by Dr. Cameron Webb, a senior advisor on the White House COVID-19 response team from the University of Virginia School of Medicine. Thank you so much for joining us tonight, Doctor.
Thanks for having me. Glad to be here.
So more than 44 million people have received at least one dose of the COVID vaccine so far, and executives from Pfizer and Moderna testified today that they're on track to produce enough doses for 300 million Americans by the end of July, with an additional 100 million from Johnson & Johnson if they receive FDA emergency authorization. But the big challenge, of course, remains distribution. What are you seeing right now as the greatest hurdles to getting those doses out to Americans as quickly as possible, and what could improve this process?
Well, there are a couple of things. I think first and foremost, it's making sure that we have really good channels through the states to not only get the doses from the manufacturers to the states, but also get them from the states into the arms of the folks who are the hardest hit and the highest risk. And so making sure that we're always getting those vaccine doses to the places where they need to go to prevent severe illness and prevent death, that's kind of our priority. And so we want to make sure that that's happening. But I think it's proceeding on schedule. I think as we expected, we're seeing a ramp up in doses every single week. Since we came into the White House 34 days ago, we're up by over 57%. So we like where things are going in terms of the trajectory, and we should be on pace to get those doses to the 300 million people in the timeline the president set forth.
You sound rather optimistic, but certainly anyone who's tried to sign up for a vaccine or help a relative to do so has faced the challenges of the current system. Should the Biden administration be doing more to try to streamline the distribution and sign-up process on the federal level so that it's not so piecemeal from city to city and state to state?
Well, and I want to temper that optimism, because I think the truth of the matter is we have to work hard. We have to stay focused on exactly what needs to be done. And yes, every state is going to play out a little bit differently. But I think that there is a lot of coordination from the federal standpoint. The states are certainly administering quite a bit of vaccine, and also we have these new federal sites that we're using as well. So we're complementing the process in the states with these new federal archetypes that we set up: our large community vaccination centers, our retail pharmacy program, program, our community health centers program. So we're trying to make sure that there are more and more venues for vaccination. And what I always remind folks is that the truth of the matter is we are currently in that moment where we're ramping up the number of doses that are available. We'll get to a point where we have a lot more doses that are available, and what we have to make sure is that we have the infrastructure to accommodate that. And I think that we're heading in that direction. So I think that yes, it is still tough for a lot of people. I think the hope is that in the next weeks to months we should have a dynamic where everybody who's over 65 who wants to have a shot certainly will have one, and then even beyond that we'll get to the point where everyone who wants a dose can have one.
And you focused on equity issues related to tackling COVID-19, and we've certainly seen headlines in recent weeks that despite efforts, minority groups are still not being vaccinated at the same rates as white Americans. I want to just put up one of those headlines from the Wall Street Journal yesterday on the situation in California, and the headline is, California is losing its campaign to vaccinate racial minorities equitably, and the article notes that Black and Latino Californians collectively account for 59% of the state's reported COVID-19 infections, but make up 19% of those who have been vaccinated. In contrast, white residents account for 20% of infections and 33% of vaccine recipients. First, just tell us what you're seeing from your position on how prevalent these types of disparities are when it comes to equitable vaccine distribution and why these gaps still persist.
Yeah, we're seeing these gaps in lots of places all over the country. And one of the first things that we called for is good data in terms of what the vaccination process looks like in states and localities all over the country. And once we have, that information, once we can see exactly what the doses look like, where the doses are headed in all these different communities, then we can start to diagnose that problem and say, well, what are the challenges that we're having? And certainly we talk about vaccine hesitancy. It's become a common phrase across the country, but it really boils down to a couple different dynamics. And one is confidence in the vaccine, its safety, its efficacy, the institutions that are distributing it, and then ultimately the reasons why the government officials are telling you to take it. So that's the confidence piece. And then there's the convenience piece. That's actually access to places to get vaccinated. And we want to make sure that folks have both. They have confidence and they have access to the vaccine. And so those are the dynamics that we're constantly contending with. I think there's people talk about vaccine hesitancy in the communities that we see it in, but it's also some level of organizational hesitancy in terms of understanding what has to be done to get out there and get those vaccine doses to the communities that have been the hardest hit and the highest risk. So we're working on all fronts to make sure we navigate all those dynamics.
And lastly, what are the most important steps that the Biden administration can take to help close those gaps? And do you feel that enough is being done at the federal level?
Well, I think there's always more that can be done. I think the important steps that we're taking is that we've really infused equity in every aspect of our vaccine response. And so if you look at all of the federal vaccination programs that exist, our community vaccination centers, they certainly have equity tied into where those centers are located. Our retail pharmacy program, the same is true. The same is true with our community health centers program. We're making sure that we're infusing equity and making sure those doses are going to the communities that have been the hardest hit at every step along the way. One of the most important things is feedback from the communities that have been the hardest hit. I think it'd be a mistake to try to design this and execute this without a constant amount of feedback, bi-directional input, into what this program is going to look like. And so we're continuing to seek that. We're doing a series of stakeholder roundtables this week, actually, and engaging with a lot of different groups. And we're going to be iterative. We're going to continue to get new and better information to make sure we're reaching the communities that, again, have been the hardest hit and that are at the highest risk. And that's our pledge. That's our promise to the American people, is we want to make sure this is an equitable process.
Dr. Cameron Webb, we appreciate your insight and thank you for your time.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.